Okay, now we are going to focus on the brain and the spinal cord specifically. We've looked at the meninges, we looked at the meninges and the central nervous system. Now we're going to look just at the brain itself. We're going to start with acute encephalitis. Okay, there's acute and then there's chronic. Acute means fast onset of symptoms. Chronic means it's been a slow progression, a slow accumulation of the symptoms. Acute, hours to days is the time frame. Chronic, days to maybe weeks is the time frame. You'll also notice in the first bullet what's called subacute. This is going to be a gray area in between acute and chronic when it comes to time frame. For humans, we see that acute encephalitis, for the most part, is going to be caused by viruses. Viruses that are carried by insects. Not to say that there aren't other viral infections, which we're going to talk about, a couple of them here in this lecture, but the majority of them are going to be caused by what I refer to as arboviruses. Arboviruses are viruses that are spread person to person using a biological vector, an insect, such as a fly or a mosquito. Not to say that there aren't bacteria that can cause encephalitis, but what we have found is that the bacteria that can cause encephalitis, it's generally going to start as a bacterial meningitis that progresses and then after a time becomes a bacterial infection of the brain, encephalitis. Here we're going to see something that's, when it's the arboviruses, it's going to bypass the meninges and meningitis and go straight to brain infection. Signs and symptoms of acute encephalitis. You're going to see behavioral changes. As the virus is there, one goes in, thousands come out, that whole thing. It's going to interfere with normal neuronal activity, which means certain neuronal pathways will be affected. There will be changes in brain chemistry. Thus, you're going to see behavioral changes, confusion. They're going to appear slightly altered, and this will increase. These symptoms will increase as the inflammatory response in the brain increases. And it's going to hit to a certain point where, well, there's going to be issues with consciousness. They're going to be dropping out, passing out. There's going to be some misfiring of the brain, seizures. And they're going to be showing some symptoms of meningitis. Because if there's inflammation in the brain, there's also going to at first be inflammation of the meninges. Treatment's going to be some form of an antiviral. Acyclovir seems to be our top one right now. Acyclovir, remember, it's the thymine nucleoside. It mimics the thymine so that it inhibits the completion of DNA synthesis. First one we're going to look at, you're going to see a lot here in the US, is HSV-1 or HSV-2 encephalitis. If it's a young infant, neonate, chances are the exposure was during passage through the birth canal. The virus will overwhelm the developing immune system, will infect, pass through the meninges into the brain, and will inhibit early development, early childhood development. Can have a high mortality rate, a relative high mortality rate. I'm sorry, not a high mortality rate. It is a low mortality rate, but a high incidence of leading to developmental issues later, mental retardation, as well as physical development due to impaired motor neuron function. We see that with HSV-1, the one that historically we have is attributed to oral herpes. Those cold sores, remember, it travels up and down the trigeminal nerve that innervates the lips, the nose, the cheek, and just under the eye. Travels up to the ganglia, down, back and forth. Well, sometimes it can jump to the central nervous system. You end up with a herpes simplex 1, HSV-1, or HSV-2, if that's what's now causing the cold sores. Encephalitis due to this. Lowered mortality rate for this, especially in the older the patient is, and lowered long-term issues, as long as there's treatment sought. Treatment's generally going to be high dose, intravenous, acyclovir, lots of fluids, anything, as well as steroids to minimize the inflammatory response. Minimize the chances of immune damage to the central nervous system. We also have what is referred to as the JC virus. JC is the initials for the first patient. This one causes what is referred to as progressive multifocal leukoencephalopathy. This is going to be a viral encephalopathy that is generally associated with AIDS patients or other patients that are chemically or radiation induced immunocompromised. Okay, there's going to have to be some severe immune dysfunction or immunocompromisation. It's not very common, thankfully, because it is generally considered to be fatal. Our antivirals don't work as well, and since they're already immunocompromised, the antivirals that would generally slow down viral replication until the immune system could catch up, well, there's no immune system to catch up, so still treat with antivirals such as zidovudine, probably acyclovir also, and supportive care. Keep the patient as relaxed and as comfortable as possible.